When the patient arrived at the clinic, she was with her parents and she was very upset because of the length of time it had taken for her to come to a specialist clinic. She was in a lot of pain, her wound was infected and she was struggling with the different treatments that she'd had. And she was then given a course of antibiotics over a longer duration of time, and compression was started slowly for her as she was unable to tolerate it up until that point. When the patient started the evaluation, she had a wound measuring 5.2 by 3.3 centimetres on her shin. The wound bed was 90% unhealthy. She had light erythema around the wound and edema, and the normal skin conditions associated with somebody with chronic venous disease. The exudate was moderately exuding and she had intermittent pain which was controlled with regular analgesia. We decided to use the DURAFIBER Ag because of the percentage of unhealthy tissue in the wound bed.
Morning, how are we today? How's it been?
It's been alright actually, it's been really good.
Any pain?
I haven't had painkillers this week. It's been, yes, the day I had it was a bit raw, but after that it's been great.
So you've had 2 weeks now of the dressing, haven't you?
Yeah, 2 weeks on this dressing, yeah.
Okay, grand unveiling. Wow, look at that.
Oh, it's looking so much better.
It is, that's a bit sticky today.
Oh, it's a lot smaller, especially
It is, isn't it? Yeah. Oh, the exudate is so much less, isn't it?
Well, it's just, it's coming at the sides, even though it's staying as long,
Yeah.
it's coming right
Yeah.
in. It's the best I've seen it in a long time.
Well, I'm really pleased with that. I bet you are too. Well, the swelling's gone out of the leg, but also all that discoloration, that red.
Oh, it has. It's definitely a lot of the
changed, doesn't it? Yeah.
Probably why it's hurting a lot less as well.
Oh God, yeah.
It was so swollen.
Yeah, it was very swollen, wasn't it? You can actually see the wound bed now. It's getting cleaner. See that dressing?
Especially on the left side, because
Yeah.
that looks so mucky.
Look at that island in there. Got an island coming in there in the middle. Can you
Yeah.
see it? That little dot.
It would be nice if that joins up.
Well,
and I
that
can get
will.
3 then.
Yeah. And there, look. All new tissue. Look. Wow, that's so good. When we've struggled, haven't we? Yes. Well, you've struggled.
A long time with this one.
Yeah.
It's probably been over a year now.
There we go. That is so good. Lovely.
Before starting the dressing, it was very painful. I got to the stage where I had to start having days off work. I was taking painkillers every day. When I first started taking the dressing, then I was having painkillers when it was being dressed, but now I've got to the point where I don't need them anymore because it's not hurting at all. It's getting smaller. And it's not just kind of every now and again, like every dressing change has been getting smaller. There's been less fluid coming off it. I know that it's not leaking through, which is even on a personal level, because that's the thing, it's not just about the pain, like even on a personal level, I know that it's not there, and sometimes you could smell it because it would be so bad, so that's great. It's really great, it's really confidence. It's comfortable to wear, it's not, because I've tried lots of different bandages and dressings, and they're not all comfortable to wear even if they work, whereas this one's working and it's comfortable, so I can't complain about that. It's been really easy to just carry on as if it's not there, so it's been nice. So in the last year I've been on 10 different courses of antibiotics because it's been continually infected, and even when the course of antibiotics is finished, a lot of the time the infection hasn't actually gone. So I've had to keep going back on them, and in the last 2 weeks I've been off antibiotics and there's been no more recurring infection, which is the longest period that's happened since it started about a year ago.
The DURAFIBER is very straightforward to apply. You can cut to just overlap the wound. It seems to adhere to the wound bed, and the patient's been wearing the dressing for 3 to 4 days. When you come to remove it, it's stayed in position. It hasn't stuck to the wound bed and not to the wound edge, which is often that patients complain that the dressings are painful at the wound edge. And it's very easy to remove and leaves no residue or fibres in the wound bed. The DURAFIBER has lifted a lot of the sloughy tissue as well as improved the granulation tissue. We've seen islands of epithelium, an increase of granulation tissue, and the slough seems to be lifting off upon dressing changes. The exudate is now slight, so it's only requiring twice weekly dressing changes, and the patient reported this morning that no longer is the exudate coming through to the outer bandages. When we took the dressing down today, the exudate had only come through to the outer surface of the dressing, no further.
How's it looking? How's it been?
It's been fine, no pain at all. It's been comfortable, hasn't slipped.
Good. Good. I will just cut the bandage off. Ooh. Wow, that's looking good, isn't
It's
it?
coming so much.
It has.
Especially on the
Okay.
left.
Yeah. That's really good. We're very pleased with the performance of the dressing because it's reduced the exudate greatly. She's now having less dressing changes. The pain itself has gone from being very, very painful before she started the dressing and then diminishing, and now she has no pain whatsoever, which has made her life a lot better. And because she's so young and active, she's able to carry on with her activities of daily living. The wound bed looks so much more healthier than it did when we first started on the DURAFIBER Ag, and the surrounding skin, because there's not so much exudate, has improved vastly and is looking a lot less inflamed, and her eczema has diminished as well.
I've been fine, same as the first 2 weeks really. It's not really been hurting. I'm completely off painkillers. I haven't been on antibiotics. It's been comfortable when I'm sleeping. I haven't been waking up in the night. It's been fine when I'm out and about, so it's been really good, yeah. It hasn't moved, it hasn't pulled. Sometimes when the bandage starts going down, the dressing tends to pull a little bit, but it's been great. Not a problem. I didn't even notice this there, to be honest. So. I was in a lot of pain before when I was on the maximum dose of painkillers, and I was on lots of different types because we were trying to find something that worked. They were even looking at nerve blockers at one point. I've been completely off painkillers now for about 4 weeks, 3.5, 4 weeks. So it's been really good. It's particularly useful for me because in the last year I've been studying for a start. So I've been studying 2 different courses. So it's helped with my memory and brain fog. With work I'm on my feet a lot. So I'm able to get around a lot better without any problems. But the main one has been with driving. So I'm a relatively nervous driver, so I don't like driving if I've had any tablets that would affect me. And I did find it quite stressful driving when I was on such a high dosage of painkillers. So that's been really good. I've been on the antibiotics now on and off for about 2 years, particularly in the last probably 6 to 7 months. I've been on them continuously, different types, because I've started getting really bad allergic reactions. Like welts were breaking out. We weren't sure what was the cause of it. And then since I've stopped getting infections and the silver dressing has managed to keep the infection away, then since stopping the antibiotics we found out that that's what was causing a lot of the allergies. But it's extra useful for me as well because I'm on warfarin, so it's one less thing I have to worry about it interacting with.
We at Cardiff, yes, would try DURAFIBER again because although it's been a small number of patients that we've seen the benefits in pain and the reduction in exudate, and I think that for the patient is very beneficial.